Tonight, part of the title is Coping with Uncertainty, and I think anyone who has either waited for a scan for themselves, the results of a blood test, or a family member who's waiting with them, knows the anxiety that comes with uncertainty. And you know, we all know life is uncertain and unpredictable, but nothing quite makes it so crystal clear as when you're going through cancer with a loved one, or you're going through cancer yourself. So let's talk a little bit about coping with uncertainty in cancer. Dale, let's see yours.
Some years ago, I was on a federal study section and awarding grants from the federal government, and I was impressed that several of the applications were for ovarian patients dealing with the stress of and anxiety that's generated by going for the next scan. And these women were having enormous problems, enormous data about that. And in Dr. Mukherjee's book, he talks about Carla, I believe is her name.
Carla Reed.
And he was 4 days late getting to her with another, and she got depressed. She got clinically depressed and anxious, just waiting for that. So you know, when you're in that surveillance period, and it's time for your 3-month scan or your 3-month blood draw, that's very anxiety provoking, you know. And so it helps people to accept them where they are and to talk with them about that and listen.
And Karen, you know both sides of that.
Yeah, absolutely.
You do.
Absolutely. You know,
Tell us a little bit about your experience.
Well, no, just the common notion of, and I think many of the audience or surely my panel members know as well, the notion of the Damocles sword, the analogy of the Greek myth where the sword is hanging over Damocles by just a hair, and that uncertainty is anything can break the hair. You know, the next blood test could show that my CA-125 is now elevated again, and so I need to go through it again, or the scan isn't what I intended, and so there are peaks and valleys. I think in general, when somebody first finishes their first round of chemo and they're done for a while, they might feel some relief, and then over time, so it's just going to go up and down. And there's a new symptom. I've got this pain. I got this pain in my leg. Could be that I hit the coffee table yesterday, but it could also be, you know, something else. So it's tough. It's tough.
Mm-hmm. And is there anything to offer, Larry? You know, to patients.
Right. So I don't mean to be flippant, but to be alive is to be uncertain. Mm-hmm. Right. So I think there's two things that seem to work in the dynamics I establish with people I care for. One is to reflect on how you dealt with uncertainty in other things. And it's not to say that there's not a magnitude difference with the diagnosis of cancer, but I think one of the myths out there is that we become different people when we're critically ill, that somehow we develop different coping mechanisms, and I don't think that's true. So I think sometimes I have found it useful to ask people to reflect on how they made decisions in the past. And for some that works. Secondly, I think it's about identifying the source of the uncertainty. So if I've not said something well, or in a way that you can understand, then the source of uncertainty is, I don't understand what you just said to me. On the other hand, if the sources of uncertainty is, will my CA-125 level come back high? Well, there's no way to know that. So I think it helps sometimes to key in on those uncertain elements that you can actually moderate or modulate.